Hey, welcome back everybody. David here with Med School Bootcamp again. So in this video, we are now going to talk about urinalysis basics. So believe it or not, there's actually a ton of information pathologically that we can learn about our patients by looking at a urine sample or looking at their urine and testing it. Here we're going to focus on three of the main ones that they actually test you on at this level. However, there are several other things that you can do when examining someone's urine to figure out what their pathology is. So the three ones that we're going to focus on here include the gross urine, which is essentially saying urine that we don't need a microscope to see. So the macroscopic view of urine, so what we see when we look at it with our eyes. We're also going to focus on the urine dipstick, and then we're going to round it out with the urine sediment. So first, if you're seeing someone's urine sample, the first thing you might notice is the color of the urine. And believe it or not, this is actually really important for a pathologic state, right? Yes, we know that urine can be more clear or more yellow from a state of dehydration, which is helpful information. However, there are other things that can also show up. So while normal urine might be yellow or amber, if it's red, that can be indicative of things like hematuria or blood in the urine. Certain medications can cause redness. One of the most classic ones is rifampin. And can you remember what rifampin is used for? That's right, it's an antimicrobial. Another cause is a porphyria. So the one that we need to know at this level is acute intermittent porphyria. And one of the findings in patients with this condition is what we call port wine colored urine or a reddish colored urine. So this is also in the differential. If a patient's urine appears red, yes, it could just be red blood cells. However, it could be a medication. It could also be a porphyria. And finally, a less common finding is black urine. For the most part, when you see this black urine finding in a test question, I want you to be thinking about a condition called alkaptonuria. Remember, this is the congenital condition that has a problem in the degradation pathway of tyrosine, which ultimately leads to a pigment formation in the tissues and this unique finding where the urine in these patients can actually turn black if it's exposed to air for too long. This is very, very unique. And so if you see this in a test question, I want you to think about this condition first, unless they give you other information that indicates this would not be the best answer. The other important thing to look at here is what we call the turbidity, and that is the cloudiness. Why is this important? Well, cloudiness can be a potential sign of an infection. So right off the bat, just by looking at someone's urine, maybe we're suspecting they have an infection, right? Maybe you're working up for that. If you see cloudiness in the urine, that is a clue, that is an indicator that makes you more likely to think, yeah, we're going on the right track here. We're looking at an infection potentially. Obviously, we'll get more information before we decide on a treatment option, but these are kind of good clinical clues that you can get, right? And that's kind of the goal in medicine, is to use your clinical clues and use your thought processes to come to the diagnosis for the patient in order to help treat them. So in summary, the main things you're going to get from the gross urine is going to be the color, which we can see right here, a yellowish to a more darker color. And you might also see some other unique findings, such as redness in the urine. And we've talked about a couple things that can cause that presentation. So next, let's look at our urine dipstick. So the urine dipstick is a diagnostic tool that can help provide a ton of information about patients and their urinary sample. One of the first things I want you to notice here is that the pH of the urine is normally between 4.5 and 8. This is different than our blood pH, which we typically say is between 7.35 and 7.45. Urine is more acidic on average. So while I don't think you need to memorize these numbers specifically, I think it's a good idea to have a rough understanding of urinary pH being less than our typical blood pH. The urine dipstick can also give us information about something called the specific gravity. This is not something we need to know in depth, but just in summary, the specific gravity is the ratio of urine density over pure water density. And really what we need to know is, how do we categorize pathologies? So what kind of pathologies would have a high urine specific gravity? So a high specific gravity might be seen in things like heart failure or volume loss, or even inducing contrast to the body. So anything that produces a more concentrated or dense urine, or contrast, for an example, which is a larger molecule that is excreted by the body, that's going to create a higher specific gravity. On the other hand, a low specific gravity might be seen in things like diabetes insipidus, because this creates a very dilute urine and a low urinary density overall. The urine dipstick is also very helpful for determining what kind of molecules are seen in the urine. Remember, certain things we expect to see in the urine, certain things we do not expect to see in the urine. So things that we typically would not expect to see in the urine include molecules like glucose, and thus if we had glucose in the urine, this might be indicative of a pathology such as diabetes. We would also not typically expect to see protein in the kidneys. So if we do have protein, this indicates what kind of pathologies might be associated with the patient, such as diabetic or hypertensive nephropathy, or a nephrotic syndrome. Much more on this to come. But nephrotic syndrome basically says that patients have an excess amount of protein in their urine. Greater than 3.5 grams per day is typically a diagnostic criteria for nephrotic syndrome. And again, this is useful information because we would not typically expect to see protein or definitely not this much protein in the patient's urine. And so if we do see it on the urine dipstick, this is helpful for narrowing our differential diagnosis. Other things that can be helpful are the presence of ketones, might be indicative of DKA or diabetic ketoacidosis. Leukocyte esterase positive is suggestive of a UTI, as well as a nitrite positive test. And I want to highlight these briefly because these are really important, right? Sometimes they will give you a patient presentation where you might think there's an infection, and then they'll present you with some labs. And in those labs, they'll tell you that the patient was positive for leukocyte esterase and nitrites. This is further confirming your suspicion that the patient has a urinary tract infection. Leukocyte esterase is an enzyme that is produced by our white blood cells, and thus it makes sense that if we have more white blood cells in the area, more of this enzyme is present, confirming our suspicion that the patient has a UTI. Similarly, bacterial infections can lead to an increased level of nitrites, and thus a positive test. And the last one I want to talk about here for the urine dipstick is the K.A.N positive. As you can see, I've included our world famous high yield marker over here. And the reason for that is this is probably one of the most common trick questions that they like to ask students, although it's not going to be a trick for you because I'm going to tell you the secret right now. So first things first, K.A.N positive is suggestive of hemoglobinuria, myoglobinuria, or hematuria. The tricky part is that when students see a positive heme, they automatically think of red blood cells. There must be blood in the urine, but that's not necessarily true. This could be myoglobinuria or hemoglobinuria. So the only way to confirm that this patient actually has blood in the urine is to confirm with microscopy. So put another way, a patient sample that has positive heme plus positive red blood cells under a microscope equals hematuria, or red blood cells in the urine. But a patient who has positive heme but has a microscopy that is negative for red blood cells means that they do not have hematuria. There's no red blood cells in the urine. So the other two things that it could be would be the myoglobinuria or the hemoglobinuria. But the point here in the tricky portion of these questions is that you can't tell for certain that the patient has red blood cells in their urine just by getting a positive heme. You need to confirm that with a microscope. And that's the trick that question writers often ask of students. And if they don't understand these differences, and if they don't understand that a positive heme potentially means hematuria, but not for sure, then they can get confused on these questions and ultimately get them wrong. If you understand this principle, it'll be great because it will show up many different times throughout your medical journey and test-taking career. And the final one we'll talk about in this video is the urine sediment. So you can see the microscopic view, or you can see urinary cast. So urine sediment essentially means that a sample of the urine is centrifuged, and then a portion of it is collected and evaluated under the microscope. And you can see different types of cells, some of those being white blood cells, red blood cells, or something called acanthocytes. Sometimes these are also called spur cells. And essentially they're a type of dysmorphic red blood cell that has little projections that kind of vary in their size. So this is my attempt at drawing an acanthocyte, and you can compare that to a typical red blood cell when it would have more of a circular appearance, whereas this type of appearance is more indicative of a pathologic state. This can be associated with a variety of different pathologies, including liver disease or vitamin E deficiency, but the key point is that this is an irregular red blood cell. These are things that we can see under the microscope. And last but not least, we can see urinary cast. This is very important as well for determining pathologies of a patient. It's so important that we've dedicated the whole next video to going over urinary cast, so I will see you all in the next one.